This lecture will cover how the American College of Radiology appropriateness criteria are developed and how to use the criteria to help choose proper imaging modalities. In doing so, this presentation will cover background information, an explanation of the expert panels that create the appropriateness criteria, a discussion on the literature search that is used to create the guidelines, as well as the evidence tables that summarize the literature search findings, how the appropriateness ratings are created, how to use the American College of Radiology appropriateness criteria, a discussion on the Anytime, Anywhere application for mobile devices, and lastly, a concluding slide. Before we get started, it is important to define what the appropriateness criteria are. The ACR appropriateness criteria are evidence-based guidelines that are used to assist referring physicians and other providers choose the most appropriate imaging modality or treatment decision. Of note, these criteria are developed for a specific clinical condition, and by using these guidelines, providers are able to enhance quality of care and contribute to the most effective use of radiologic services. Now, during the 1990s, the ACR recognized the need to define national guidelines for appropriate use of imaging technologies. Subsequently, the ACR Task Force on Appropriateness Criteria was created, and in 1994, deliberations had begun to develop these nationally accepted, scientifically based guidelines. Of note, the most recent version, updated in December 2011, contains 175 topics with over 850 variants. In creating the criteria, their methodology relied on a combination of input by physicians from a variety of other medical specialties, scientific evidence, and when the data from these studies were insufficient, expert consensus. The physicians just mentioned are members of the expert panels in diagnostic imaging, interventional radiology, and radiation oncology that developed the appropriateness criteria. The panels must include 10 to 16 members, of which 60% or more should come from radiology or radiation oncology. At least one member must come from a medical specialty not just mentioned. Other requirements include appropriate geographic and gender representation, representation from both academic and community physicians, and represent all imaging modalities. A sample of the many organizations working with the ACR is provided here. For a complete list, please go to acr.org/AC. As mentioned above, scientific evidence is relied upon for the methodology. To fulfill this requirement, a Medline literature search is completed using two classes of keywords. The first is related to a specific condition, such as fever or abdominal pain. The second has to do with the diagnostic or therapeutic intervention of interest, such as CT or MRI. Combining the two classes narrows the search to the topic of interest. Certain criteria should be met by the literature search. Studies with abstracts are preferred, but the search should exclude articles with only summaries or case reports. The study must be only 1 year older than the last topic update, or less than 5 years old when including a new topic. Please note that the search strategy may be revised to improve outputs. Once relevant literature is found, summaries of each study are created using evidence tables. The evidence tables are completed by the topic author and expert panelists. When filling out the forms, they must consider the strength of evidence of the study and group it into one of the 4 categories, as described in the table below. We can see that Category 1 is for a study with sound design. Categories 2 and 3 are for studies whose designs are not ideal, but whose conclusions may be considered valid. Lastly, Category 4 is for those studies whose designs are too poor for their conclusions to be considered valid. There are specific criteria for rating the strength of evidence based on the type of study. As it is beyond the scope of this presentation, if you would like more information, please go to acr.org/AC and click on Evidence Table Development. Now that we've discussed the expert panels and literature review process, let's look at how they use this data to create the appropriateness ratings. There are up to 3 rounds of ratings and are on a scale from 1 to 9, grouped into 3 categories as seen here. The usually appropriate category is defined as the study or procedure being indicated in certain settings. The may be appropriate category is defined as the study or procedure possibly being indicated in certain settings, and the usually not appropriate category being defined as the study or procedure are likely not to be indicated in these settings. There is a 4th category of no consensus. This occurs when the definition of having greater than or equal to 80% agreement within a category is not achieved. If and when a consensus is achieved, the median of all the ratings is determined to assign the final appropriateness rating. For example, let's say that CT abdomen with contrast receives the ratings of 1.6, 1.7, 6.8, and 2.9. Since greater than 80% of the ratings are a 7, 8, or 9, there is consensus that this modality is usually appropriate. Taking the median of these ratings, the final rating is an 8. Now that we've gone over what goes into making the criteria and how imaging modalities are scored, let's look at how to use the appropriateness criteria. Given an example of an adult patient we suspect has appendicitis but is presenting atypically. The first step is to go to acsearch.acr.org. In the search engine that appears, there are 2 fields to fill in. First, select the appropriate category. In our case, we are interested in diagnostic topics only. Secondly, type in the clinical indication. For our case, we type in abdominal pain. Lastly, click on the Perform Search button. Once we click on this button, our results page will load. Many topics are included under abdominal pain, but for our example, we are interested in right lower quadrant pain, suspected appendicitis, as indicated by the blue arrow. Click on this topic. After clicking on the link, a PDF will open that includes the appropriateness rating, comments, and relative radiation level for several variants on the topic. Let's pick variant 2, as our adult patient is presenting atypically. From the criteria, we can see that CT abdomen and pelvis with contrast is the most appropriate imaging modality, based on the clinical indication of abdominal pain in a patient suspected of having appendicitis, but who does not have the typical presentation. Now, for those providers with smartphones and a willingness to pay $9.95 a year or $15.95 every 2 years, a Skyscape application is available through the ACR website. Go to acr.org/AC_PDA and follow the on-screen directions to download the mobile app. This application provides instant point-of-care access to all of the ACR appropriateness criteria, which can be directly downloaded to an iPhone, BlackBerry, Palm, or other PDAs, smartphones, or mobile devices. Once downloaded, open up the app and you will see the table of contents, as shown below. Click on Topic List by Panel. Next, choose Diagnostic Imaging. For our case of suspected appendicitis, now choose Gastrointestinal Imaging. Once the following menu appears, scroll down to right lower quadrant pain, suspected appendicitis. After clicking on the aforementioned topic, the list of 4 variants is shown. In our case, we are interested in variant 2. After clicking on variant 2, read the corresponding table to determine the most appropriate imaging modality. Again, in our case, we select CT abdomen and pelvis with contrast. Currently, the ACR's appropriateness criteria contain the best current evidence for over 175 topics and 850 variants in the December 2011 version, and as such are the most comprehensive evidence-based guidelines for diagnostic imaging selection, radiotherapy protocols, and image-guided interventional procedures. A sample of these imaging topics, among others, include breast, cardiac, gastrointestinal, musculoskeletal, and neurologic, as well as interventional radiology, and the radiation oncology topics of bone and brain metastases, breast, head and neck, and lung. Thank you for listening to this lecture and for your time. For any more information, please go to www.acr.org/AC.